Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pancreas Transplantation. Introduction. A pancreas transplant is a surgery used to treat type 1 or occasionally type 2 diabetes. The surgery replaces the patient's failing pancreas with a healthy one from a donor. Your doctor may have recommended a pancreas transplant. The decision to have this procedure is yours. This program explains pancreas transplantation. It discusses the transplant surgery, its risks and complications, and how to take care of yourself after surgery. Pancreas. The pancreas is located in the abdomen, behind the bowels and in front of the spine. The pancreas has two main functions. 1. To secrete special juices that help digest the food we eat. 2. To secrete special substances called hormones into the blood. Insulin is the name of the most important hormone. It helps control the level of sugar in the blood. Digestive juices from the pancreas move through the pancreatic duct to the first part of the small intestines. This part is called the duodenum. The pancreatic duct is joined by the common bile duct on its way to the duodenum. Diabetes. Diabetes is a disease that affects millions of people every year. It can happen if the pancreas makes little or no insulin. This is called type 1 diabetes. It can also happen when the body does not make enough insulin or isn't able to use it. This is called type 2 diabetes. Without the body making or using insulin properly, blood sugar levels get too high. Over time, the high level of sugar in the blood can cause serious problems. A pancreas transplant is most often used as treatment for type 1 diabetes, but it is not the standard treatment. There are possible life-threatening side effects of the medicine prescribed to prevent the body from rejecting the new pancreas. The standard treatment for type 1 diabetes involves taking insulin and possibly other medicines, being physically active and eating healthy, controlling blood pressure and cholesterol levels. People that may benefit most from a pancreas transplant have frequent difficulty controlling blood sugar levels, repeated insulin reactions, severe kidney damage, uncontrolled type 1 diabetes. People who have severe kidney damage caused by type 1 diabetes may receive a kidney transplant at the same time as a pancreas transplant. Sometimes the kidney transplant happens after the pancreas transplant. This strategy is used to control diabetes-related kidney damage in the future. People with type 2 diabetes usually will not benefit from a pancreas transplant. This is because type 2 diabetes usually happens when the body is unable to properly use insulin. A new pancreas would only help the body produce more insulin, not use it better. In some people with type 2 diabetes, the body can still use insulin well, but the body doesn't make enough insulin. These people may benefit from a pancreas transplant. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Before the transplant. A pancreas transplant replaces the patient's failing pancreas with a healthy one from a donor. The healthy pancreas most often comes from a deceased donor. Your healthcare provider will determine if a pancreas transplant may be safe and beneficial for you. Your evaluation will include physical exam, blood tests, imaging tests, including X-rays. You will also have financial consultations to discuss the cost of the procedure. After you have selected a transplant center, you will need an evaluation to see if you meet the requirements for a pancreas transplant. This may include your ability to take medicines and follow advice, Health and medical conditions. If you also need a kidney transplant, your transplant team will decide whether it is best for you to receive both the kidney and pancreas transplants during the same surgery. They may decide to do the kidney first and the pancreas at a later date. After you have been accepted as a candidate for a pancreas transplant, your name will be added to a national list of people waiting for a transplant. You may be on a waiting list from a few days to several months. Once a suitable donor becomes available, you may receive the transplant. A suitable donor is one whose blood and tissue types match yours. It is important to provide the transplant team with information about how to reach you at all times. Also, arrange transportation to the transplant center ahead of time. You will need to be ready to go at a moment's notice. To keep your mind and body healthy while you wait for a transplant, involve yourself in healthy activities like relaxing and spending time with family and friends. Keep all appointments with your healthcare team. Follow any diet and exercise guidelines. Take all medicines as prescribed. Surgery. This operation is done under general anesthesia. This means you will be asleep during the operation. The surgical team will monitor your vital signs and make sure you are safe during the operation. The surgeon will then make an incision down the center of your abdomen. The surgeon then places the new pancreas and a small portion of the donor's intestine into your lower abdomen. The donor's intestine is connected to your small intestine or bladder. The donor's pancreas is attached to blood vessels that bring blood to your legs. During this time, your own pancreas is left in place to continue helping with digestion. If you also receive a kidney transplant, the blood vessels of the new kidney will be connected to blood vessels in your lower abdomen. The tube linking the kidney to the bladder will be attached to your bladder. Your own kidney will be left in place unless it is causing complications. The entire surgery usually lasts about 3 hours. If you get a kidney during the same surgery, the procedure will take a few more hours. Risks and complications. The operation is generally safe, but complications can happen. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urine retention, cut lips, chipped teeth, sore throat, headache. More rare but serious risks of anesthesia include heart attack, stroke, pneumonia. Your anesthesiologist will discuss these risks with you. He or she will ask if you are allergic to certain medications. Other risks of the procedure include infection, bruising or bleeding. There is a high risk for complications after pancreas transplant surgery, including bleeding, blood clots, excess sugar in your blood, failure of the donated pancreas, infection, rejection of the donated pancreas, urinary complications, including urinary tract infections. The immunosuppressant drugs also have risks and side effects. Side effects of these drugs include acne, bone thinning, excessive hair growth, high cholesterol. Other side effects may include high blood pressure, puffiness, skin sensitivity, swollen gums, weight gain. After surgery. After the surgery, you will stay in the intensive care unit for a few days. You will spend about 1 week in the transplant facility. After you leave, you will have frequent checkups as you continue to recover. During your stay, your transplant team will monitor your recovery. Your team will provide you with instructions on post-transplant recovery, care, lifestyle changes, and medicines. Following a successful pancreas transplant, your new pancreas will begin making insulin right away. You may need to take low levels of insulin during your stay at the hospital. This helps prevent stress on the newly transplanted pancreas. By the time you go home, you may be able to stop taking insulin entirely. Your healthcare provider will decide this before you leave the healthcare facility. When you go home, you will gradually return to your daily activities and continue to recover. This can be a long, slow process. At first, you may need assistance when walking. Your diet may at first consist of ice chips, then clear liquids, and finally solids. It is important to eat well-balanced meals that include all food groups. Your healthcare provider will tell you when you can go back to work. This is usually after 3 to 6 months. After your surgery, you will take medicines to stop your body from rejecting your new pancreas. You will take these medicines for the rest of your life. These drugs are called immunosuppressants. They suppress or prevent the immune system from rejecting your new pancreas. Immunosuppressive medicines weaken the immune system. For this reason, transplant patients must take medications to prevent infections. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. A pancreas transplant is a surgery used to treat type 1 or occasionally type 2 diabetes. The surgery replaces the patient's failing pancreas with a healthy one from a donor. The healthy pancreas most often comes from a deceased donor. If you also need a new kidney, you may receive one during your pancreas transplant surgery. If your healthcare providers determine that you are a good candidate for a transplant, your name will be placed on a waiting list. You may be on a waiting list from a few days to several months. During surgery, a surgeon attaches a donor pancreas to your small intestines or bladder. The donor's pancreas is attached to blood vessels that bring blood to your legs. Your own pancreas is left in place to continue helping with digestion. Surgery usually lasts about 3 hours. You will need to take immunosuppressive medicines daily for the rest of your life. These medicines keep your body from rejecting your new pancreas. Your transplant team will discuss your new medicines in detail. Your healthcare provider will tell you when you can go back to work. This is usually after 3 to 6 months. Thank you for using Explain.